Hi, I'm Tom Kimball.
And I'm Tracy Kimball. Welcome to MS Learn Online. Whether you have or think you may have MS or care about someone who does, finding the right information is an important first step.
Dr. Jack Burks is the Director of Program Development at the Holy Name Hospital Multiple Sclerosis Comprehensive Care Center in Teaneck, New Jersey. In MS 101, Part 1, Dr. Burks will discuss what MS is, how it's diagnosed, who gets it, and more.
Multiple sclerosis is a disease of young adults that affects the brain and the spinal cord. And what happens is that there's a short-circuiting in the brain and the spinal cord. Like, for example, what does that mean? Say I want to move my right hand. Well, I get the idea in the thinking cells of my brain called the neurons, but I've got to get the message down to my hand. And that's done by an electrical connection through a series of wires called axons to the cells in the spinal cord. They go up to the nerves, to the muscles of the hand, and I move the hand. Well, in multiple sclerosis, there's a thinning of the insulation of the electrical wires. It's like an electrical system.
Okay.
And when that thinning occurs, if it gets severe, there's a short-circuiting of the message. So I think about the idea, I want to move my right hand, but the message doesn't get through as fast, or sometimes it gets short-circuited, doesn't get through at all, and I have trouble moving my right hand. So it's an electrical problem with insulation.
And the destruction of that insulation is the actual autoimmune reaction that becomes MS.
Yeah, Rick, that's correct. It's the basis of the damage is an immune system or an autoimmune disease. And what happens is that I like it like a fort. You know, the immune system are the sentries of the body. They keep all the bad guys out. They shoot all the bad guys so they don't get into the body.
Okay.
Well, in multiple sclerosis, somehow they get confused and they sort of turn around and start shooting in the fort. And when they shoot in the fort, they shoot at the myelin. And so the myelin gets damaged by the immune system that is made to protect us.
Okay, let's go back to the 101 portion of our MS and define myelin a little bit more in layman's terms.
Well, the best way to define myelin is everybody knows what an electrical wire is.
Right.
Everybody knows what insulation is. The electrical wires in the brain that connect the various cells are called axons. The wires are the axons. Every one of those in the brain has to have insulation, or the message gets short-circuited. Electricity goes diffusely rather than the way we want it to go. Well, myelin is this white fatty substance that surrounds every wire in the brain and the spinal cord. So that's what myelin is, and it's an insulation problem.
So I've been diagnosed. I've been told, yes, you have one or the other forms of MS. And one of my first questions is, am I gonna die from MS?
That's a frequently thought of question, not asked nearly enough.
Really?
But the answer to that is MS is not a fatal disease per se. It's a disease that people have likely for the rest of their lives, but it comes and goes. People will have an attack, the immune system will get angry and damage the insulation, and then it'll calm down, and people will be stable for a while, and then another attack will come by. Then after several years, that's called the relapsing remitting form of the disease, but after several years, the attacks get less. That's the good news. The bad news is the patients start progressing between attacks, and then pretty soon they stop having attacks altogether. It's just a progressive disease. We call that part of the disease secondary progressive disease. That's the standard. That's 85% of the people start with relapsing remitting disease. There are some other less common forms of the disease. One of those is primary progressive.
Okay.
And that's a progressive form of the disease that really never had an attack. They just started off progressive. So relapsing remitting goes to secondary progressive, and if you just start off progressing, they call it primary progressive disease.
Is it possible that somebody could come into your office and be diagnosed with primary progressive right off the bat then?
Yes, that's usually the way it is.
Really?
Yeah, we look for a year-long progression of the disease with no exacerbations and no other obvious cause for that. And so therefore, that's how a primary progressive patient presents. The symptoms are primarily in the spinal cord for primary progressive. And the other thing about primary progressive, it affects older aged people.
Okay.
In their 40s and 50s. So I'm trying to think about the differences. Primary progressive starts in the 40s and 50s, where relapsing remitting disease starts in the 20s and 30s. Although we do see relapsing remitting patients in children sometimes, and sometimes in older adults. But usually it's 18 to 40s when it starts.
Okay. The youngest you've seen?
2 years old.
Really?
Yes.
Who gets MS and why do they get MS?
Well, we've talked about young adults. We've talked about starting in between the ages of 20 and 40, and if it's primary progressive, it's a little bit older. Women get it more than men. And we don't know we're not quite sure why that happens. But there may be a hormonal influence within the immune system that may trigger this, because other autoimmune diseases are more common in women as well. Where your ancestors are from, there's a genetic component to this. And so people who have Northern European ancestry have a greater risk than, say, African blacks or native South American people. So there's a genetic component to this. It's not a hereditary disease. Half your kids will get multiple sclerosis, but there is an increased risk for multiple sclerosis in family members.
Okay.
Where you live has something to do with your risk of multiple sclerosis. If you live in temperate climates, your risk of multiple sclerosis is very high, especially if you've lived there during your childhood years, than, say, someone who lives near the equator. But you have to have the right genes and the right climate. And some people think that, and there's some data that would support this, that sunshine is important. If the more sunshine you have, the less likely you are to get multiple sclerosis. So therefore, people who live in warm climates with lots of sunshine have less MS than people who live in temperate climates, for example. And possibly the underlying issue there is not sunshine, but it's the result of sunshine, which is vitamin D.
Right.
Other people, like we haven't seen much MS in Asian countries or in South American countries, for example, until recently. So why are we seeing all this new MS? Another risk factor came up. It's freedom from parasites. It turns out that parasites have an immunomodulating effect, meaning it can actually dampen the immune system. So people who have parasites are less likely to get MS. When they have MS, their disease is less if they have parasites. And now that we're cleaning up parasites in the world, we're seeing more MS in these other countries. So there are a number of risk factors. There's probably a toxic component to this at some place we haven't identified yet. But when I've listed 6 or 7 risk factors for why people might be at a higher risk of getting MS, and there's probably many more we don't understand.
When I was diagnosed, my doctors told me that predominantly, as you mentioned before, MS is a woman's disease. More women are diagnosed than men. But it seems to me in the last few years, I've been stumbling across, literally and figuratively, more men my age and younger, who seem to be diagnosed. It seems like more men recently than ever.
Well, Rick, we're seeing just the opposite, actually. When you were diagnosed with MS, we were telling our medical students that for every man with MS, there were 2 women. Now we're saying for every man with MS, there are actually 3 or 4 women. So we're seeing an increase in women. And it's probably real. Some people would say, well, you're just diagnosing it better or whatever, but I think it's probably real. And that if you look at primary progressive disease, it's about the same. Equal numbers of men, equal numbers of women. But relapsing remitting, the predominant type of MS, is much more common in women. So the assumption is there is some sort of hormonal basis to risk.
There's so much to learn about MS. Fortunately, there are great resources to get good information, such as the National MS Society. We want to thank Dr. Jack Burks for starting us out with some basic facts about MS.
And there's much more to learn. Please join us for Part 2 of MS 101, when Dr. Burks will talk more about what symptoms MS can cause, and he'll talk about treatment options.
See you then.